water bottles. I don't know what will be open through the rest of the park when you go exploring, so don't expect that you'd always find something open where you can grab some bottled water somewhere. There are water fountains around, but again, such a big park, I want to make sure you don't get caught somewhere without some supplies. Okay, and then one of the things that, of course, I hope you do get to experience would be some of the wildlife here. I know that you potentially have already seen quite a few deer. If many of you were coming in early this morning or had been walking around just a little bit, you've probably seen the deer the most, but you might have also caught, just by being looking out over the lake, some views of waterfowl, different birds that would be out there. Squirrels, I'm sure you're going to see a lot of squirrels and chipmunks. Those would be out. One of the things with the deer to think about is that we could still be in tick season. We haven't had them too bad this year. We had quite a bit of a drought for a while. Now we're getting some rain back through. Leaves are falling. So one, that's a really good reason to always stay on the trails, right? No need to go off trail. Then you really don't risk getting anything such as ticks or poison ivy, anything like that. But two, obviously, we don't want anybody to take home any memories such as tick-borne illnesses or poison ivy rash, that kind of thing. I want you to take home good memories from your time here in the park. Now, I know with the rain coming in, one thing, I'm never affected by our mosquitoes, but maybe there's some of you that does affect, so just think about that if you go on the trails that are around the property right here, because as I said, quite a bit of the trail system will go along the lake, and it will be quite boggy in some areas as the next few days with the weather as it develops. So be aware of that. Other than that, if you're out during the middle of the day, I mean, just be aware of where you are and just be aware of where you're walking. Most wildlife is going to hear when you're coming, but you guys have a good set of trail systems right here at the Evergreen area that aren't used by the millions and millions of visitors that come to the park. So I think that you're really situated in a great spot to be able to see different wildlife. If you're walking quietly, I think you'll have a good chance to see some things there. Early mornings are going to be pretty cool, as I said, so you probably won't see too much out and moving, and that might be in your benefit if you like to be up early. Now, last thing I brought with you, or to you, is this book here. If anybody would like to take some of those home, I have a bunch here. I just figured if people wanted to pick them up now, or I'll leave them at the registration desk as well. And it just has a lot of photographs of the park, and I thought maybe this would be something if anybody wanted to take home something like this with them. Stone Mountain Park is one of the largest green spaces around Atlanta, and while the colors are just starting to change, I didn't know how much time you really would have to explore, so I definitely would like to make sure that you take home something like this. And again, I'll just have some back there when you're done if anyone wants to get them. Otherwise, have a very good conference. Thank you.
Thank you, Naomi. That was very informative. As far as the shuttle is concerned, we actually are providing an SUV. There is a phone number on the schedules in the lobby, hotel lobbies. If you would like to use that, you just need to call that number, and they will let you know when the SUV is ready to pick you up. And that's going to be around the park and to and from the hotels. So just to let you know that. And now I'm going to introduce Carl to introduce our guest speaker. Thank you, everyone.
So hi, good morning once again, everybody. I hope you've had a good rest and you're ready and fresh for today's proceedings. TEPHINET is extremely honored to have Dr. Rebecca Martin with us today. Not only is she extremely accomplished, she's also extremely gracious. Dr. Martin is the director of the Center for Global Health at the U.S. Centers for Disease Control and Prevention. She has worked both domestically and internationally in immunization, HIV, and health system strengthening, and now leads CDC's global efforts to protect and improve health globally through science, policy, partnership, and evidence-based public health action. Dr. Martin has over 20 years of experience working in international health. Since 1991, she has worked in the global health arena and has had CDC assignments in Kenya, Tanzania, and Denmark from 2002 to 2011. When she was based in Denmark, she actually conducted her work in the Caucasus. She was detailed to the WHO African Regional Office from 2002 to 2006, based in Kenya as a senior epidemiologist in the Inter-Country Immunization Program Office for 8 East African countries. From 2006 to 2008, Dr. Martin served as Program Director for Strategic Information and Human Resources for Health within the CDC's country office in Tanzania. She led and implemented studies in partnership with the Ministry of Health to measure and evaluate the HIV/AIDS epidemic and strengthen national capacity to respond. Between 2008 and 2011, Dr. Martin was detailed to the WHO European Regional Office as the Regional Advisor for Immunization, where she spearheaded regional efforts to strengthen immunization and surveillance systems, provide evidence for the introduction of new vaccines, achieve the goal of measles and rubella elimination, and maintain the region's polio-free status. Most recently, from 2012 to 2016, Dr. Martin served as the director of the CGH, Global Immunization Division, which leads CDC's global polio eradication efforts, accelerated disease control for vaccine-preventable diseases, and the introduction of new and underutilized vaccines, and of course, the strengthening of immunization systems. Without further ado, may we give Dr. Martin a round of applause, and she'll join us on stage.
So thank you and good morning. So not only is this a conference, but you also are part of a public health exercise to learn about poison ivy, tick-borne diseases. It's fabulous. So first of all, I truly do want to thank TEPHINET for the honor to be here and the privilege to speak to you this morning. And I was supposed to really get you all energized for the rest of this week. And so I really want to see a lot of engagement and the hope for a great meeting. So thank you so much for the opportunity to be here today. And following up on Dr. Copeland's speech and comments last night, it's always an honor to follow in his footsteps and to continue to learn from him and his work. So where should I point this? Maybe that's okay.
Guinea is dealing with a lot of diseases. It's a country that very few people knew about until the Ebola outbreak. CDC started working mostly in 4 areas: epidemiology, surveillance, laboratory, and emergency management. The biggest difference is with the field epidemiology training program to detect diseases and epidemics on the ground and respond to them very effectively. We brought capacity to develop an emergency operations center to respond, to coordinate emergencies that is totally led now by the ministry. The structures are built, the people are trained, but what has been acquired is very fragile. There's daily costs to make sure that the program is sustainable so that when they will be hit with another.
Oops, how do we? I have to go back. It's not in order. Yeah.
Guinea.
Okay. All right, so I wanted to make sure you're all awake and paying attention. So we've done that. I showed you that because they always say a picture is worth 1,000 words. And I think seeing and all of you that what you do in action is so incredible. And it's an honor to be here with friends and former colleagues that I see and current colleagues on this effort that we're leading today. I wanted to start by, first of all, just acknowledging that today we're going to be launching the Field Epidemiology Training Program Enterprise. And along with my co-chair, Dr. Mike Ryan, who's the executive director for the WHO World Health Emergency Programs, we are honored to have this position and the importance of the work that we're doing. We know FETP is an important program at country level. We have seen how people have responded to outbreaks in Nigeria, in South Africa, in Tanzania, in Thailand, and how the FETP program has strengthened health systems in those countries. But also at a regional level, the value we saw in the response to the West Africa Ebola outbreak, and also with the yellow fever that started in Angola, moved to DR Congo. We saw some cases in other countries, Kenya. But we saw FETP graduates going from one country to another, helping each other and supporting the work that's needed in the region as well. And we see that the world sees value in the FETP, in how we see more countries wanting to have FETP, and also how we see partners wanting to engage in FETP, seeing this as a sustainable and important program for building the public health workforce in countries in the efforts to detect, prevent, and respond. I want to go back a bit in time to start where we started, and FETP started in 1980 as an experiment. Let's see what we can do and where we can go from here. Well, I want to just acknowledge that in June of 2019, we have 11,178 frontline FETP workers in 54 programs. And as you see here, over 4,300 advanced FETP graduates from 70 plus countries. So I just want you to take a moment and applaud the incredible work that's been done. And this truly is an enterprise, and why we're coming now to this point, to make sure that this can continue. This just shows a map of the world of where CDC has supported FETPs worldwide, and it has continually grown and substantially covers the world. Now, you don't see the United States here, but we have, as you may know, the Epidemic Intelligence Service, which is very much similar to the work of the FETP and what it was modeled after. So it is truly a global program. I want to run through a few slides to talk about the impact of FETP that it has had. First of all, in detecting and investigating outbreaks. First of all, this Nipah outbreak in Bangladesh. We see here engaging in communities in detection through event-based surveillance. And we know the engagement of the community is critical in order to have surveillance systems that work and can respond rapidly. And lastly, the FETP trainees have been involved in the eradication of polio virus and have worked all over the world. And I highlight Nigeria because just in August of this year, Nigeria declared 3 years free of wild polio virus. And this is a major accomplishment. We have not seen wild polio virus in Africa for 3 years. It's amazing to be at this point in time. I'm not going to say that there's not a lot more work to be done, but it's just that this is a moment in time to celebrate, but to get back to work. So one of my favorite writers is Marshall Goldsmith, and he says, "What got you here will not get you there." And it's the importance of we can't keep doing the same thing and expect new results if we have to adapt and change. And this September, the Global Preparedness Monitoring Board released its annual report called A World at Risk. And I want to highlight 3 key recommendations which very much play into the FETP enterprise and the work that you do at country level as well and globally. The first is that countries must invest. They must commit to making sure that they have strong health systems. Secondly, that countries must have strong health systems or build them if they don't. And this is not a government-only event. This is whole of government, whole of society, priority engagement and involvement of community, and multi-sector. And this is critical. It is not expecting one body to do all of the work to build the health systems, but it does take everybody and a whole of society, whole of government effort. And then thirdly was to prepare for the worst. And in doing so, make sure that you have the investments, both human resources and financial resources. And I think these are 3 key recommendations going forward of how do we get there in making sure that we must build strong health systems, and the FETP enterprise is a key component of this work. I wanted to talk a little bit about where we are. What's the world look like today? We see a lot of urbanization, and by 2050, it is expected that nearly 70%, 68% will be living in urban settings. And urban settings are growing up, but also out. And how do we make sure that that everybody has access to health? We see population movement around the world, around countries, around regions, and geographic areas. The issue of everybody having access to health services is critical. We also see the increase of insecurity and conflict. And World Bank has put out a report that by 2030, 46% of the extreme poor in the world will be living in fragile countries in conflict or having violence. That's huge. And then we have what's happening with the environment and how that relates to health, droughts, longer rainy seasons. How does this impact health as well? Moving into areas where humans have not lived before. And then we have countries facing not only infectious diseases, but also the increased burden of non-communicable diseases. So this is the environment we are in today and how we looked at our future. So what do we do? Where do we go from here? We need to predict, we need to plan, and we need to act. We need to make sure we have sustainable FETP programs in countries, and that there is a career path for FETP colleagues and graduates to ensure that the health systems are built. And this is critical work. So our colleagues at the Task Force for Global Health were thinking one day and came up to write a paper on having a meeting in Bellagio to really think about what do we do with FETP. It's a priority for everybody, but how do we ensure that sustainability? And from the Bellagio meeting came the concept, the emergence of an enterprise, and making sure that this is a global effort to sustain the importance and grow the FETP program. This led then to a meeting in Geneva, bringing in the World Health Organization, who you'll hear from my co-chair, Dr. Mike Ryan, as well as Dr. Oliver Morgan shortly, where at that point, even we had Dr. Tedros, who spent time with the colleagues in the importance of making sure we have the sustainability of the public health workforce, the field epidemiologists, and the need for this training program, and making it an enterprise. And now we're here in Atlanta to launch this. I wanted to highlight a few of the recommendations that came from the Bellagio and from the meeting in Geneva. From Geneva, there was the concept to form a strategic leadership group, for which Dr. Mike Ryan and I are now the co-chairs. The recommendations 2 through 7 came out of the Bellagio meeting in terms of how do we make sure that we monitor, how do we assure programs stay, that there is a career path for graduates, how do we continue to strengthen the quality of the program, and how do we assure sustainable funding. Now, the 8th recommendation, foster enhanced alignment with global health priorities, I want to pull out because it is very critical. There is currently the Sustainable Development Goals. WHO has the 3 billions that they're working towards. We have programs in eradication, elimination, epidemic control, initiatives. How do we bring this together and leverage what these programs and what these systems and initiatives are building in the surveillance and the laboratory workforce, and how do we make sure that that comes together for a country to build its health system with a strong population and program as well. So this is very critical in moving forward the recommendations. So what will be the next steps? So for the senior leadership group, we have to complete the membership and finalize that. The governance has to come from that as well, and we have to finalize the governance structures and what will be engaged in that. But I can tell you, CDC is committed. We have spent over 50 years engaged in FETP, and all of the CDC directors that I have worked for, including Dr. Redfield, our current CDC director, sees this as a priority for every country to have its own capacity to detect, prevent, and respond. And only by doing that will the world be safe. Only by then will we be sure that we are ready for the next pandemic to hit the world. So I want to take the last few seconds just to thank you again. We look forward to taking this forward. I wish you a good conference. I'm very excited to be here for this. It's a great opportunity to see everybody, but also to hear about the incredible science and work that you're doing in ensuring that policies are put in place to make populations safe. So thank you so much, and I will return back to Carl. Thank you.
Okay, thank you very much, Dr. Martin, for introducing the theme of the conference, which clearly will be carried through over the next few days. And as Dr. Martin mentioned, she is one of the co-chairs of the Strategic Leadership Group of the FETP enterprise. And the other co-chair of the enterprise is Dr. Mike Ryan. He was not able to be with us today, but he has sent a short video with a message for all of us. Dr. Mike Ryan is the director of the Global Health Emergencies Program of the World Health Organization. So could we have his video, please?
Hello, everybody. I'm sorry that I can't be with you today in Atlanta. However, considering how important training programs in public health intervention and FETPs are to me and to WHO, I wanted to take the time to share a message with you. I'm a proud alumnus myself of the EPIEP program, the Field Epidemiology Training Program in the European Union. Over the last 40 years, the number and scope of FETP programs has grown around the world. Today there are, I think, around 86 programs that include nearly 160 countries. That's a tremendous geographic footprint for what is impressive growth, but growth that raises new challenges, such as how do we sustain quality and consistency, focus and standards and so on. How do we make sure that this product and the people and the workforce that is so vital to the world that we produce is of the highest quality and makes a difference? Despite the undisputed benefit of epidemiology training programs, you all probably know in the room, those of you who manage and support these programs, that financing and finding the investment in programs remains challenging. Demonstrating their value for money and encouraging continued and long-term predictable financing is a challenge, especially in countries where resources for public health are already limited and challenged. So to address these challenges, the Task Force for Global Health developed the Global Field Epidemiology Roadmap in 2018. The vision of the roadmap is that every country in the world will have the applied epidemiology capacities needed to protect and promote the health of its own population and to collaborate with others to promote global health. This vision aligns closely with the vision of WHO, and we're very happy to be associated with and participate. At the start of this year at WHO in Geneva, we were pleased to host TEPHINET and the task force to develop an implementation plan for the Global Field Epidemiology Roadmap. During that meeting, I met with participants and discussed WHO's engagement directly with them. One of the key recommendations of the Geneva meeting was to establish a strategic leadership group for FETP that will provide high-level strategic guidance and advocacy for public health intervention programs around the world. WHO is fully committed to supporting this approach, and I'm delighted as Executive Director of the WHO Health Emergencies Programme to co-chair the Strategic Leadership Group with Dr. Rebecca Martin, Director of the Centre for Global Health at CDC. I'm honoured by the request to act and proud to serve. I'm personally committed to promoting and supporting field epidemiology training efforts in any way that I can, especially given that I've come and I'm a product of such programs. And just before I finish, it's important to say that this model is a model that can be applied across many of the other disciplines in public health, many of the other disciplines in health. Epidemiology training programs are a beacon of standardization, of quality, of commitment for many other health system deliverables. I wish you all the best for your meeting this week. I'm sorry I'm not there, and I do look forward to working with you all in future and to serving in whatever role I can to support the development of those programs around the world. Thank you.
Okay, thank you to Dr. Mike Ryan. Our third speaker in this keynote address session is Dr. Oliver Morgan. Dr. Oliver Morgan is the director of the Health Emergency Information and Risk Assessment Department in the Health Emergencies Program at the World Health Organization. Dr. Morgan's portfolio includes global surveillance for public health emergencies, risk assessment of new events, epidemiological field investigations, data analytics, and developing information systems for emergencies. Previously, Dr. Morgan worked for the US Centers for Disease Control and Prevention from 2007 to 2017. He also worked for the United Kingdom Health Protection Agency 2002 to 7, and with non-governmental humanitarian organizations from 1996 to 2000. Dr. Morgan has extensive international experience that includes epidemiological investigation of infectious disease outbreaks, chemical and radiation exposure incidents, terrorist bombings in London, natural disasters, and humanitarian civil conflicts. Dr. Morgan also holds a doctorate in epidemiology from the Imperial College in London. Dr. Morgan was not able to join us today. He is, however, with us through a live video link. So once we get Dr. Morgan's presentation, we will invite Dr. Rebecca Martin on stage, and both she and Dr. Morgan will be available to answer your questions. Thank you. May we link in Dr. Oliver, please.
Good morning, everybody. I hope you can hear me clearly. I'm very sorry I can't be there with you in person. I am actually taking this video conference from London, kindly hosted by Public Health England, who've set me up with this video conference facility. So thank you very much for them at the outset. It's really a great time to be engaged with FETP right now. The launch of the FETP enterprise is really an exciting step for the future of FETP, and also the establishment of the senior leadership group, I think, will be a vital turning point for the FETP enterprise itself. I think as we look towards the future for FETP, it's difficult to think about the future without recognizing the contributions of Dionisio and also a number of other individuals who have been very instrumental in establishing the enterprise in this strategic leadership group, including Patrick O'Carroll from the task force, as well as Kip Baggett from CDC, both of whom have been instrumental in turning visionary ideas into practical next steps for all of us. I thought it would be interesting to share with all of you 4 different perspectives of FETP from WHO's perspective. The first is the importance of FETP for member states and for WHO. Every month, my team in Geneva identifies about 7,000 signals of potential health events, of which we investigate around 300 each month. That's a very large number of events that are happening at the global level, and of course there are many more happening at the national and subnational levels in the countries where you all live. But the role of WHO in addressing health emergencies isn't WHO's alone. It is actually a joint role with all member states around the world. And our foundational collaboration for health emergencies is founded in the 2005 International Health Regulations. Within the International Health Regulations, it clearly defines the need to have joint capacity for both WHO and the member states, and all of you and the entire FETP community is really a vital part of that capacity at the core of delivering our joint responsibilities in the International Health Regulations. The second perspective, which is important, is to understand the link between FETP and universal health coverage. Now, universal health coverage is a strategic goal of Dr. Tedros, who's the Director General of WHO, and at the UN General Assembly last month, there was broad commitment by many member states to work towards delivering on universal health coverage. For FETP, we must see our efforts within that context also. If you look at the joint external evaluation process and the evaluation tool that is developed for JEE, having trained field epidemiologists is one of the key indicators. One trained field epidemiologist per 200,000 population. But also, beyond that summary indicator, it's also important to recognize the contribution of FETP graduates and fellows in the areas of non-communicable diseases and chronic diseases, in the area of supporting EPI programs, surveillance systems, and many other aspects of public health. It's, as part of the UHC agenda, it's important, therefore, that we make sure that field epidemiologists are recognized and included in health workforce accounts. It's also important that we address the need for career pathways for field epidemiologists as part of the UHC agenda, and that we also address the sustainability of FETP from funding from host governments to support FETP into the future. The third perspective is really to understand FETP as the world's frontline public health workforce. To address public health challenges at a global scale, we need a global health workforce. We have two very important partners in this effort. One is the GORN Partner Network, and members of the GORN Partner Network are with you at the conference this week. But also TEPHINET is an important player in this regard too. I would like just to pause to congratulate TEPHINET on its work with TEPHIConnect, and just to underline how important that effort is so that we really understand what the global capacity is for epidemiology when major emergencies do occur. The next generation of field epidemiologists, when we think about our global workforce, must also be able to operate in an increasingly complex environment. We find ourselves at WHO working more and more in complex settings, often in countries and areas of countries that are affected by conflict, and working in those environments require an additional skill set that's important for the FETP community to consider. In fact, almost 70% of the outbreaks that we deal with in the health emergencies program at WHO are in the fragile, conflict-affected and vulnerable countries that Dr. Martin mentioned. The fourth perspective is around the uniqueness of FETP for public health. Now, I spent some time while I was preparing for this meeting thinking about what makes FETP so unique. Well, on the one hand, we expect that the modules that are taught to FETP fellows are of the same academic standard as those taught in Masters of MPH courses or Masters in Epidemiology courses. Also, there's an expectation that graduates of FETP courses should have the same foundational knowledge in epidemiology as any epidemiologist. So what is it that we're really looking at when we're talking about the field epidemiology workforce? Well, clearly it's the field component that sets aside an FETP fellow from somebody who's taken an academic course in epidemiology. I think this is a really important moment as we launch the FETP enterprise to reflect on that for a moment and think, how can we strengthen the field component in addition to maintaining our academic standards? I think it's really important for all of us to recognize that in many instances, in many parts of the world, when an outbreak does occur, it is all of you who are going to be the boots on the ground, the very front line, the first responders to a public health situation. I think there's some elements that we need to strengthen within our curricula, such as data capture, data management, which are components that in my personal experience frequently deploying to the field still, I find as major weaknesses within our global workforce. Another component of being a field epidemiologist is translating real-world problems into an epidemiological context and being able to work through a problem using our epidemiological tools and turning our results into practical decisions in the right time frame. And then an additional dimension is really what you might call the human touch. It is the ability for us to engage with communities and individuals who are affected by health crises and work in a compassionate and an effective way with them. I think it's very important for us to recognize the importance of that softer skill set for field epidemiologists. So as we get ready for the next health event, as we get ready for tomorrow, as we get ready to implement the FETP enterprise, there are some things that we need to do to make our contribution, our unique contribution to public health, even more robust. I think, as I alluded to, we need to have the right training for us to deploy in the environments that we need to respond to. That might include great awareness of humanitarian contexts and the humanitarian system at large. And I'm pleased that we are co-delivering such a training course with US CDC later this month. I think it's also important that we strengthen our relationships with the GORN Partner Network and we continue to support TEPHINET, both at the same time as co-initiatives that together are going to be successful. And then I think there is an issue around the tools that we have in our toolbox. Our colleagues from GORN have made some presentations and we'll be talking about the GoData software that's been developed for contact tracing. But we also need to continue to focus on what are the tools that we can all use and all train on so that we have a common approach when we deploy to the field. I think in the end, when I think about the uniqueness of FETP, it's really that the training is not enough. When I work with FETP graduates, it's really their experience that they bring which is the most important. We all need to be trained, we all need to have a solid academic foundation, but really it's the experience that FETP fellows bring that others do not have, which is the most important component. So in conclusion, I want to just reiterate the importance of FETP for public health from many different perspectives and the importance for WHO. As you've heard from Dr. Tedros and Dr. Ryan, FETP is an important part of WHO's future strategy and for all of us to deliver on the public health goals that we all have. So thank you very much indeed. I look forward to answering some questions along with Dr. Martin. And again, I'm sorry that I can't be with you this time round, but I look forward to meeting many of you over the course of the next year or two until I can get to the next Global TEPHINET meeting. Thank you very much.
So thank you very much, Oliver, for that. I'd like to invite Dr. Martin up on stage And just a trivia question to prepare you for International Night. I'm not sure how many of you know that Dr. Morgan was born in South Africa and spent a few years growing up there. Okay, great. So please, may we take your questions? Patrick, I'm not sure, would you like to join Dr. Martin on stage? She looks rather unaccompanied.
Rita.
Okay, so there are microphones in each aisle, so if people would like to come up to the microphone, and feel free to ask any questions that you may have regarding the keynote addresses and the FETP enterprise, the SLG, any doubts or clarifications that you might need. Okay, please don't run, don't trip over getting to the microphone. Okay.
Thank you for this opportunity to ask a question. Rebecca, this is Bill Nichols, if you can't see me, with the lights in your eyes. I just wanted to get a little bit of detail around how the SLG is operating, the frequency of meetings, whether that's done in person or via Skype like we're doing today, or and then how you're taking those meetings and guiding or giving guidance to the FET enterprise on next steps.
Thank you, Bill, for the question, and we want to hire you and bring you on board for these efforts. So, as I said, today is sort of the public launch of talking about the FETP enterprise and the senior leadership group, and in the coming months before the end of the calendar year, we want to get the membership of the senior leadership group as well as the governance structure. So to say that we have agreed upon this, and maybe Dr. Mike Ryan and I are crazy accepting the chair without having the structure underneath us yet, but we are fully committed and believing in this. So that is our goal for the end of the calendar year, is to really start to build that structure, as you said, build a frequency and how often we meet, what will be the membership. But we do want to have a very strong membership where we can have a working group to take on specific efforts and take on specific topics of how we strengthen the FETP enterprise. And you saw on the recommendations slide that I showed, numbers 2 through 7 are really what the senior leadership group should be leading, making sure that we assure quality, that we have a sustainable program. So we are going to need everybody's engagement, and I want to do a call to action now for all of you to be engaged in the enterprise in making sure that we make it the best we can, but also giving your guidance, your advice, your experience in how we meet these recommendations and goals. And so we will be reaching out as well to do that. Thank you.
Dr. Seymour Williams.
Good morning. Thanks I've always been jazzed about the global roadmap, because it means that when you're working with your FETP, you're not just working on your FETP. We actually have a goal to every country in the world to do this. But maybe Dr. Morgan could elaborate a little bit. I follow you on how universal healthcare links to FETP, but I wanted a little bit more, because sometimes when people hear universal healthcare, they hear clinical care. And what I've always advocated for is that as a public health doc, I deliver care for the population. So a little bit more on how we're going to link universal health care, or UHC, with FETP, and how do we get that paradigm in people that population health care is just as important as clinical care.
Great. Seymour, thanks very much for the question. The UHC agenda is really focused on universal health coverage. Now, the definition of what that coverage includes does obviously focus on clinical care, but it also extends beyond that to include public health as well. So that's the important part for us to engage in, is to make sure that when we're talking about universal health coverage, that we don't get lost in that conversation, that the public health components are recognized and invested in. And FETP, as one of those public health investments, is delivered on. So I think the role of the SLG in this is going to be critically important. Both Mike Ryan and Rebecca Martin and the future members of the SLG will have an important role in advocating for FETP as a critical part, as a core component of delivering on the UHC agenda as we go forward to the next few years.
And I would just add, I think the universal health coverage, along with the global health security agenda as well, fit very well. There is that intersect between what's needed for public health system and for a health delivery system. And this is the intersection of those two is where it's very critical that we work closely together and align the work.
Hello, thank you for taking questions. I am new to the field of epidemiology, and so being here and hearing about the roadmap forward has been pretty exciting for me. And I was wondering what role the network will have in and what kinds of plans the network has for creating a more clear career path for field epidemiologists that might give options outside of academia. And kind of where you see that heading.
No, thank you for the question. Maybe Patrick, you'll say something too. But for me, it is one of the recommendations that came up from the meeting, which I hope Patrick will talk more about, for the senior leadership group to lead. But in countries, we definitely see different models of how FETP is implemented. I was in Tanzania and helped establish the FETP program there. And it wasn't necessarily linked with academia, but with the Ministry of Health. And colleagues who were the first cohort are now the chief medical officer, are leading the government systems. And seeing that, I think, is very important. So trying to find that quality and also some standardization will be very critical. But Patrick, may you want to say more?
Sure. Can you hear me okay?
Yeah, I can.
So thanks. That was very well put. I'll just add that many of these recommendations relate to each other. So one of the recommendations has to do with providing technical assistance and inspiration for countries to set their own workforce targets, explicit workforce targets for advanced and intermediate and basic or frontline epidemiologists. And that process will elucidate the importance of how many people are needed at each level for each country. And our hope is that will contribute to creating a career path in sort of traditional epi roles. But another part of the roadmap that you'll read about is about broadening our focus to include, for example, One Health concepts, which brings in a whole new group of professionals that we'll work cheek by jowl with over the years. That also opens up career opportunities. So you'll find that many of these recommendations, they stand, as if they're independent, but in fact they link to each other and each tends to support the other. And by the way, I have to use this opportunity to plug the presentation this afternoon. And I want to say that some of you know about the Field Epi Training Program Enterprise and the Epi Roadmap. Many of you in this room were involved in developing it, and for others it's new. But it's not done. This is the first opportunity we've had to put this all in front of you and to make sure that we hear from you about how to make it better or what we forgot to put into it, but also for you to hear where this came from. This wasn't something we invented, the few of us who have spoken to this date. As you'll hear this afternoon, there were a great number of people leaders that you all know, who helped develop this. But we want to hear from you this afternoon. So what you'll do, if you don't mind, this just came off the presses. It's still hot against my cheek because it just came off the presses. It's available for all of you to pick this report up at the registration desk right after this session. Before you get coffee, before you go to the poster sessions, grab one of these and please look through it in advance because we'd love to get your input. It's really critical. This is your chance to put your name on the list of authors for this document this afternoon. So thank you for that question.
Okay, Kashif. Oh, sorry, I think you were first, yes.
Yeah, thank you very much, Kashif Ijaz, CDC. I'm just going to go and add another comment, which Oliver, you just made in terms of responding to Seymour's question and back to Rebecca as well. When you look at the triple billion for WHO, one of the other key areas which is interrelated is the health emergencies. And when you're looking at that, I think that's another area where, because of the interrelatedness to universal health coverage and health and well-being, I think that is another key area where the FETPs have been playing a critical role and continue to play a critical role and should continue to play a critical role as we go forward. So, so there is interrelatedness when you're looking at universal health coverage, public health, emergency response, and the health and well-being of the populations. Thank you.
Yeah, hi, Marian Mullen, the EPIET program at the ECDC. I would like to follow up on my colleague who asked about a career path. I would like to come one step back. What has been a bit of a challenge in engaging countries in establishing an FETP was that the FETP program, let's say the advanced one of 2 years, does not lead to an academic degree. So people have been questioning what is the use of interrupting my career for 2 years if it's not going to bring me a master's or whatever. And I see sometimes a tendency of trying to put the FETP together with universities in order to lead to an academic degree, and I find that quite dangerous. So I would really welcome if the strategic leadership group would look into this and try to advocate across the world. And I think, Oliver, it's really nice what you said, that this is an indicator of the joint evaluation to have one trained FETP per 200,000 population. I think finally we're starting to put this in writing for the whole world to see. I would see much more value, instead of the 2 years leading to an academic degree, if these 2 years were embedded in the specialization in public health, for example. And I would really maybe like to see much more efforts being done towards integrating 2 years of field epidemiology in the specialization of public health, as opposed to putting 2 years of field epidemiology program to lead to a master's degree in a university. So this is just, you know, an idea that I'm putting out there, because I think this will probably make the difference in some countries to establish an FETP if it is linked with the public health training and not with a master's degree in epidemiology or in whatever.
No, thank you for that comment. I think this is one of the ongoing issues about, is it linked with the academia degree or not? And I think these are ongoing issues that we will have to discuss about what is some of the best balances in that, where people do, as you said, want to show some sort of a beyond their time, but what can they do in terms of moving? And this is looking at what are some of the career paths for graduates as well that will be critical, and I appreciate your comments on that. I think it's very interesting too, the world right now is very much in a place of how do we make sure the world is prepared for the next pandemic? How do we make sure that there's preparedness? And in that, FETP is so critical. Many times when I've talked with ministries of health about establishing FETPs, they say, yes, it's important, and they can give you 10 examples of where FETP has stopped outbreaks or been engaged. But then when it comes down to the budgets, what's decided whether I'm going to hire that physician at the hospital or if I'm going to hire the FETP and sustain that program, I will choose the primary healthcare physician. And I think the time is now where we can make that change and that understanding that the constant response to outbreaks, the economic burden, the cost is triple and sometimes 10 times what could be done for preparedness and being ready. And I think this is the time now that we can use our voices in the importance of this effort and making sure that we have sustainable programs in countries and linked to the right levels. CDC, I think, looking to your point as well, recognized having a cohort of sometimes 6, sometimes 10 in a country graduating every 2 years did not meet what was needed with the community on the front level. And so this front line was established, and having trained 11,178 by June of 2019 is an incredible, but the return on investment has been phenomenal. And I've spoken with some, and they're very much interested in moving into the intermediate and then the advanced. So seeing that take ground and making sure that that is sustainable in a structured and standardized way will be critical. So thank you so much for your comments.
May we take
Maybe I could just add to that a little bit, if that's okay, Carl?
Please.
Yes,
I'm behind
please.
you, by the way.
Please, Oliver, go ahead.
I think, Marian, you raised one of the kind of critical topics that the senior leadership group, along with all of you, needs to address. I think, as Patrick wisely said, these are all linked issues, and the issue around the FETP training and the academic qualifications or other qualifications, and where FETP sits within the public health workforce and or the health workforce accounts is an important one. There are many different disciplines in health and healthcare where vocational training is required, and that doesn't necessarily lead directly to an academic qualification. But then again, there are also many countries where vocational training and academic training are required at the same time in order to meet minimum qualifications. And I think there needs to be some latitude to take each context in each country as a kind of case-by-case basis about what's needed. However, I think there is an issue around consistency in training that hasn't been addressed, and we need to address that full on. And at the moment, we like to think that FETP is a kind of a badge which means the same thing all around the world. But I think we have some way to go before that is the case. And again, I think that's another issue that the SLG and all of us can work on together, so that when we do make a case and we do advocate for FETP being a core part of a health workforce, then we're talking about the similar consistency of training in all countries. So I think there's a lot to think about, but I think there needs to be a concerted effort across the SLG with all of you to address that. Thanks.
Thank you, Oliver. May I please take the last two questions? I'm just aware of time, from Navneet and our colleague in the middle aisle. This session leads directly into the afternoon session, so we can follow up on questions there. And of course, you have the opportunity at tea to talk to the speakers here. Navneet, please go ahead.
Thanks, Carl, for giving me an opportunity. This is Navneet Dand from the University of Sydney. I guess we all know that most of the emerging infectious diseases are zoonotic, and they originate at the animal-human interfaces. So to protect people from the threat of emerging infectious diseases, we need to strengthen field epidemiology training programs for veterinarians, in addition to strengthening field epidemiology training programs. So my question is that with the FETP, this enterprise, and with the global leadership group, is there any representation of veterinarians, or is there any thinking about that issue? Thank you.
Thank you, and I can say there will be. Right now, we're still a bit of a shell, but this is something, and I think your input and recommendations are very good, but this is something we've definitely talked about, and as Kashif mentioned as well, I mean, moving into the animal health has been one of the large areas of bringing veterinarians, and they have been in FETP in some countries over the decades to date, especially in some of the important outbreaks. So I think this is important, but I think you're right, having that voice and bringing that to the table is very critical. Thank you.
Thank you.
Thank you very much.
Maybe to...
Sorry,
just to add on that.
Go ahead, Oliver.
Just add on that in addition to the importance of engaging with veterinary epidemiologists, I think we need to think broadly also for other disciplines that are emerging very quickly in our modern environments, such as data science. And we also find a twin challenge that many professions face, in that on the one hand, we need to remain squarely focused on the fundamentals of epidemiology when we're in the field. But at the same time, we're expected to be able to deliver information systems at a complexity that we're used to in our everyday environments, such as checking in online for our flights and so on and so forth. And I think we're reaching a crossroads where we need to question whether an epidemiologist can be all of those things, or whether we need to look at other kind of cross-training with other disciplines to deliver on those, whether it's veterinary on the veterinary side, or whether it's on the data science side, or maybe others that will emerge.
Thank you, Oliver. the last question, please.
Yes, this is Senga from Tanzania. I just wanted to come back to the issue on the career development or the career progression of the graduates of the FETP program. I think the challenges, in particularly where I'm coming from in Africa and Tanzania, is that the systems that are already in place, they don't really, it has been a challenge to incorporate a career line or progression, particularly for people who have finished the advanced program, because it's not in the mainstream. For example, if I take a doctor, he starts on the degree and then as he progresses to be a specialist and all of that. But with somebody who has finished the masters of an EPI program, you'll find that different disciplines who can come into that program. So now having a conversion of how these different people of the different disciplines can now progress in one career has been a challenge. So I think going forward, we need to look at the systems that are already in place and see how we can try to introduce now a more professional kind of like development of these people regardless of their backgrounds. You have already touched into something like that, like for example, the continuous education programs, how even if somebody has finished and it hasn't led to a master's degree, but how they can still be considered to take up different positions, because apart from that, we might be training, but the system is failing to absorb these people and to retain them and to have them bring the impact that we hope to have. And so I'd also like to thank you, because I'm from Tanzania. I was one of the first cohorts. So thank you very much for your investment.
Nashukuru sana. No, I appreciate your comments very much, and it is the sort of thing, one of CDC's own what we've done, but I think that this is now so exciting to have it as an enterprise, that this will bring in so many more engagements of different multi-sectoral partners as well as governments. But I think we saw this with laboratorians as well, of having a career path working in a laboratory and being able to move forward. And we've worked with countries, but it does take working with each country and looking at their career paths and looking with their national science and technology institutes as well, of how to create that path and make sure there's a cadre. So we have a lot of work to do here, but I think we are all very excited about this and getting the right people on the senior leadership group to make sure that we can address this in a way and hear the voices of how we could do this and hear your input. Thank you.
Thank you. Oliver, do you have a last comment?
I mean, I think that's absolutely right in the sense that one of the aspects that we need to look at along with universal health coverage is this career pathway issue. I think we've definitely shown, as Rebecca mentioned, that FETP is a critical part of all of our public health workforce, but now we need the level of advocacy really at the highest level, at the minister's level, but we need to be talking about FETP whenever we're talking about not only universal health coverage, but health emergencies and preparing to prevent or mitigate the impact of outbreaks and other health events. So I think there's a lot of advocacy work to do. I think it's a great time to have this issue on the table. I think the SLG is a great vehicle for us to address these issues, as I said, at the highest possible level. And I think it'll be very exciting in the next year or 2 years when we come back at the next global TEPHINET meeting to see how far we progressed.
Great. Thank you, Oliver. Patrick, did you have a last comment?
Only to point to something Dr. Ryan said, which I think feeds into this. Dr. Ryan talked about the fact that FETP as a structure for building the workforce should be and will be better connected to a variety of other major thrusts and initiatives and programs of the World Health Organization. That alone will open doors that we can't even imagine right now. I think FETP working on career paths for FETP graduates is a different scenario than an FETP enterprise that's partnered with the WHO Health Workforce Development and the Universal Health Coverage Movement and a variety of other major initiatives where FETP is a part of those initiatives. I think that's going to open up a lot of opportunities in the coming years.
Okay. Thank you very much all for your attention. I know we've gone into the tea break, but I thought it was a very relevant and useful discussion. Dr. Rebecca Martin, thank you very much for being here this morning. Oliver, thank you for your commitment and for making the time to join us. And thank you to Public Health England for facilitating your link. Patrick, thank you for being dragged up on stage and not protesting. Thank you once again. Please enjoy your coffee tea break. Thank you.